Hello, my name is Lucille Evans, and my presentation is about the pharmaceutical industry's role in the opioid crisis. So, looking at the table of contents, I'm going to be going into the introduction of this topic, the background, give you some context, assess the current situation, policy analysis, look at the existing policies created for this issue, and then recommend some new policies in the recommendation section. So, let's get into the introduction. So the opioid crisis. The opioid crisis is a perpetual public health crisis here in the United States that began in the 1990s. So this is a long time ago, and it's still incredibly prevalent today and claiming more lives every day. It is defined as a rapid and continual rise in addiction, overdoses, and deaths related to opioid drug abuse. So the opioid crisis has resulted in over 727,000 deaths since 1999. 105,000 of those deaths have happened recently in 2023, according to the CDC. That is a huge number and a huge ratio of death, like a huge amount of deaths in such a short amount of time. So this number is obviously increasing every year. So the secret manipulator. So a lot of people don't know this. It's becoming more prevalently known today, but pharmaceutical companies played the main role in igniting and fueling the opioid crisis itself. They did this through deceptive marketing campaigns, influencing the medical opinions of doctors, and using lobbying to influence drug policy. The main pharmaceutical company involved in the opioid crisis, the most well known and the most well known is Purdue Pharma. So this is like the main question, the main issue. What is it? The opioid crisis has claimed so many lives at a rate that's rapidly increasing each day. What kind of policies can we put in place to hold these pharmaceutical companies accountable and finally fight back against the opioid crisis? So first, let's get into the background of the situation and give you some important context. In the 1990s, the catalyst of the opioid crisis, like I said earlier, was the overprescribing of opioids, specifically Oxycontin, an opioid drug created by Purdue Pharma. Pharmaceutical companies were funding misleading marketing campaigns that advertise opioids as non-addictive and an effective way to treat chronic pain. So these patients who had chronic illnesses and chronic pain that they couldn't get rid of, they were going to their doctors, and the doctors were just feeding them opioids and telling them, it's not addictive and it's perfectly safe to take as many as you need to, which obviously is not the truth. Pharmaceutical companies were also funding over 20,000 educational programs from 1996 to 2002 to influence physicians into prescribing more opioids. So they were funding the education of these doctors, and I guess they were altering the curriculum and convincing them that prescribing their patients as many opioids as they needed was perfectly safe. So let's look at Purdue's OxyContin sales year by year. As you can see, between 1996 and 2002, there's a humongous increase, $1.4 billion in 2001. This is due to the factors I stated before, the overprescribing, the the um, misleading advertisements, and hello, my name is Lucille Evans, and my presentation is about the pharmaceutical industry's role in the opioid crisis. So, the table of contents, I'm going to introduce the topic, then give you some important background and context, assess the current situation, and then look at some policies that have been put into place to help this issue, and then recommend some new policies that I feel would be more effective. So let's get into the introduction. The opioid crisis. So the opioid crisis is a perpetual public health crisis here in the United States that began in the 1990s. That was years and years ago, but is still incredibly prevalent today. It is defined as a rapid and continual rise in addiction, overdoses, and deaths related to opioid drug abuse. The opioid crisis has resulted in over 727,000 deaths since 1999. 105,000 of those deaths have happened recently in 2023, according to the CDC. So that is a huge amount of the deaths that already happened happening in such a short period of time, which is telling us that this problem is increasing and the amount of deaths are increasing year by year. The secret manipulator. So this is not as well known as it should be. It's becoming more well known, but pharmaceutical companies played the main role in igniting and fueling the opioid crisis. They did this through deceptive marketing campaigns, influencing the medical opinions of doctors, and using lobbying to influence drug policies. The main pharmaceutical company involved in the opioid crisis is Purdue Pharma, at least the most well known and prominent. So, the main question and main issue of this whole thing, the opioid crisis has claimed so many lives at a rate that's rapidly increasing each day. What kind of policies can be put in place to hold these pharmaceutical companies accountable and finally fight back against the opioid crisis? We're going to go into this more in a minute, but first, let's go into the background of the situation. So, some important context. In the 1990s, the catalyst of the opioid crisis was the overprescribing of opioids, specifically Oxycontin, an opioid drug created by Purdue Pharma. So, they were overprescribing these opioids. Pharmaceutical companies were funding misleading marketing campaigns that advertised opioids as non addictive and an effective way to treat chronic pain. So, they were lying to people basically and saying, take this pill. This is basically a miracle pill and will get rid of all of your chronic pain that you live with every day. You won't get addicted to it. There's no risk, which is obviously not true. Pharmaceutical companies were also funding over 20,000 educational programs from 1996 to 2002 to influence physicians into prescribing more opioids. So they were not only misleading the public through marketing, they were also misleading doctors through funding their educational programs in favor of prescribing opioids. So they were lying to doctors and telling them, hey, if your patient comes to you with chronic pain, you can prescribe them as many opioid pills as they need, and there's no problem, there's no risk, which is a lie, a huge lie. So let's look at Purdue Pharma's OxyContin marketing objectives. This is their sales year by year. Between 1996 and 2002, humongous increase in sales, $1.4 billion in 2001. This is due to what I said prior, them funding these educational programs, them overprescribing, and them having these misleading marketing campaigns, and them lying increased their profit an insane amount. So they were successful in their own lives, which was detrimental to people because it caused the opioid crisis. $35 billion was made by Purdue Pharma between 1995 and 2017 from OxyContin sales alone. So from the chart before, you would think that it tapered off at 2002, but no, it $35 billion. That is a lot of money. So let's look at the current situation of pharmaceutical involvement in the opioid crisis. So, some recent developments, pharmaceutical companies are still involved in the opioid crisis today, mostly through recent legal disputes over their involvement. So, recently, they have finally been held accountable for what they have done. Most notably, Purdue Pharma and its owners, the Sackler family, have faced legal troubles by receiving a recent $7.4 billion settlement in 2025. So, this was very recent. The settlement money was intended to be put toward opioid addiction treatment programs. So they were wanting to put this money from the settlement toward helping the problem that Purdue Pharma caused. Chain pharmacies such as Walmart, CVS, and Walgreens also received billion-dollar settlements for their involvement in the opioid crisis as well, because how are these people receiving these opioids through their prescriptions? They're going to these chain pharmacies to receive them in the first place. So some challenges and impacts of this. Many pharmaceutical companies today have actually shifted from opioids to distance themselves from scrutiny because now it's kind of become more well known that they have a lot of blood on their hands for this. This has caused a sudden and large decrease in the production of these opioids. So it used to be just produce as many opioids as you can, push them out to the public. But since they've been finally held accountable, they're like, wait, let's stop. However, the damage the pharmaceutical companies have done with their man-made plague cannot be undone. The already large population of opioid addicts have turned to illicit synthetic opioids like fentanyl, which has been detrimental, which we'll get into a second. But yeah, these people, all these people who have been addicted to these opioids and could regularly access them easily, suddenly have been cut off. So they're having to turn towards illicit synthetic opioids and substances, which is incredibly dangerous. 69% of all drug overdose deaths in 2023 involve synthetic opioids. This is 22 times the rate in 2013. This is according to the CDC. This is very recent data. This is incredibly high. So, incredibly high. And people turning to these synthetic opioids has led to an insanely high spike in deaths. So let's look into some policies that have already been put into place to try to rectify this issue. So there have been state level prescription limits. So to combat the opioid crisis, most states have put in place policies that limit the initial supply prescribed for acute pain to prevent dependency. So this is usually controlled by the state, but they'll give you like a 7 or 5 day supply. Like if you just got out of surgery and you need pain medicine for it, they'll give you only 7 days. And they won't let you refill it. So some effectiveness and limitations of this. These policies seem to be effective in preventing first-time opioid patients from developing an addiction. It also has been effective in decreasing the supply of the opioids themselves. So it's gotten rid of the opioids themselves, and it's prevented people who are just getting a one-time prescription for opioids after like a surgery. But these policies are ineffective in helping prevent addiction in patients with chronic pain and has led to many to search for illicit alternatives like fentanyl. So these patients previously were prescribed opioids for their chronic pain that they can't get rid of, and they became incredibly reliant on these because doctors were feeding it to them. And now that they've been cut off, they have turned to the black market and dangerous substances like fentanyl. So, some more policies addressing this issue, the settlement fund spending policies. So, at least 70% of the 50 plus billion-dollar settlements these pharmaceutical companies have received as of 2026 are supposed to be spent on opioid addiction, recovery, treatment, and prevention organizations. So, this money from the settlement from these companies that have caused this issue is supposed to be put towards fixing the issue. These policies have been shown to be successful when the funds are actually put towards effective interventions such as harm reduction, which is known to be very effective. However, there is no way to be 100% certain that all these settlement funds are actually being put into these interventions. So you can tell how corrupt these companies already are and how greedy they are. So who's to say they aren't, like, people aren't hoarding this money? Because people are greedy and there's no way to be 100% sure that these funds are actually being put towards these interventions. So here are my recommendations for some policies that could help solve this issue. So I would recommend some mandatory production antidotes. So I believe that policy should be put in place to make it mandatory for these pharmaceutical companies to produce and distribute overdose antidote medications such as Narcan, also known as naloxone. So these pharmaceutical companies, instead of being allowed to produce so many opioids and stuff, they should be required to produce Narcan, which would help save lives. So how would this be effective? This is a very feasible way to decrease the number of deaths from opioid overdoses because, like I said prior, like 100,000 people have been dying recently each year just from these opioid overdoses. So increasing naloxone production and distribution has been proven to significantly reduce the mortality rate for opioid overdoses. So, from this harm reduction standpoint, by providing people with Narcan, it can help save lives. So some more policies I think should be implemented. Stigma reduction campaigns. So policy, I think that policies should be put in place that require these pharmaceutical companies to fund campaigns aimed at the public and doctors to change the perception that addiction is a moral failure and that is actually a treatable chronic illness. So I think that instead of demonizing people who suffer from opioid addiction, we should instead treat it as a disease because it is a disease and it like people should not be scared to be judged or anything for having this issue. They should be able to receive help. So how could this be affected? This is a very feasible way to address the social and structural barriers that prevent people from receiving help. It also encourages doctors to provide evidence-based care that is truly effective. So by educating doctors, they can actually treat opioid addiction. So humanizing addiction is essential to solving this problem. So instead of just blaming the individual and everything for their quote unquote life choices, being judgmental, moralizing addiction, we should instead focus on treating this issue instead of demonizing people for it. So in summary, the opioid crisis has ravaged our country, killing hundreds of thousands of people a year. It was not a spontaneous occurrence, though. It was a man-made plague created by these pharmaceutical companies, prioritizing profit over the well-being of people, which is terrible. Now that we know the causes of the opioid crisis, we must continue holding these pharmaceutical companies accountable and campaign for harm reduction-based policies that will actually make a difference. And I can't wait to hear what questions y'all might have in our discussion. Thank you. And this is my works cited.